Hello, we'll be studying now about the Norma basalis. That means the viewing of the skull from below is the Norma basalis. Let us study it under three parts. Anterior part of the Norma basalis. This is anterior part of the Norma basalis. The middle part of the Norma basalis and the posterior part of the Norma basalis. Now, when you see from below, the boundaries which the Norma basalis form are in front is this alveolar arch and posteriorly is the superior nuchal lines. On the sides, if you see, this is a zygomatic bone, this is root of zygoma and the mastoid process. This forms the boundaries of the Norma basalis. We will be doing now with the anterior part of the Norma basalis, and the features here include are this one is the palate, hard palate, and this is the posterior border of hard palate. In the middle of it, this projection what you are seeing, this is called as the posterior nasal spine. It is called posterior nasal spine, to which musculus uvulae is attached. And this posterior border of the hard palate is called as palatine crest, to which palatine aponeurosis is attached. Coming to the anterior part, this is the alveolar arch of the maxillae. You find 8 sockets on either sides. These two are the two incisors. This is canine. These are the premolars, and the last one are the molars. Last three are the molars. 2, 1, 2, 3 is the dental formula. The sockets for the incisor, canine and premolar are single. That means it is not divided by any septa into compartments, whereas here if you see the molars, it is divided into numerous compartments, 2 or 3 by fibrous septa. So this is about the alveolar arch. And now coming to this hard palate, what are the bones which are contributing to the formation of this hard palate are? These two are the palatine processes of maxillae. This maxilla is giving a process like this on either sides, and these two are the palatine processes of the maxillae, and posteriorly these are the horizontal plates of palatine bone. Majority of the hard palate is formed by the palatine processes of maxillae, and posteriorly 1/5 of it is formed by the horizontal plates of palatine bone, thus making a hard palate. Then we will try to know the sutures here. So this one what you are seeing here is intermaxillary suture. That means the suture present between the two palatine processes of maxillae. And posteriorly here it is interpalatine suture. It is intermaxillary in front, posteriorly it is interpalatine suture, and the region between the two somewhat like this, it is palatomaxillary suture. Palatine bone, maxilla, so it has to be palatomaxillary suture. So overall this plus shaped suture together we call it as cruciform suture, which is formed in front by the intermaxillary suture, posteriorly by the interpalatine suture, and horizontally by the palatomaxillary suture. Okay. Now coming to the foramen here, this is called as incisive. If you see here, it is called as incisive foramen. Incisive foramen, or it is formed by the incisive fossa of either sides together will give rise to incisive foramen like this, which transmits the nasopalatine nerve and vessels, greater palatine and nasopalatine nerve and vessels. Similarly, this part of the undersurface of the hard palate is uneven. At some places it is elevated, at some places it is depressed. The depressed regions are meant for the lodgement of the palatine glands. And posteriorly, if you see here, this one is the greater palatine foramen, this one is the greater palatine foramen, which transmits greater palatine nerve and vessels. Similarly, posterior to it, you find 2 or 3 small foramens. These are the lesser palatine foramen, which transmits lesser palatine nerve and vessels. And the grooves present on the undersurface of this hard palate is meant for the passage of this greater palatine nerve and vessels. And the anterior part of this palate, undersurface of the palate, adjoining the these incisor sockets, this triangular area we call it as premaxilla. This is all about the anterior part of the norma basalis. Thank you.